Thank you, Chair. I have a few questions for Chris, if that's okay. You mentioned earlier about knots in the system, and I'm particularly interested around the challenges of red tape and how that's impacts leadership. It feels to me that when you've got staff who know what they're doing on the front line, adding additional red tape to stop them from doing that can be a challenge. I was just interested in whether you agree with that view and what we could potentially do about it.
Well, I think there's a really important balance to strike here, isn't there? In terms of this is an industry where if you get things wrong, or sorry, an industry, terrible phrase. If this is a sector of our national life where if you get things wrong, people die. So quite rightly, there should be an appropriate degree of regulation to ensure that, for example, health professionals are registered, that their practice is appropriately kind of defined. I think the real question is the degree to which leadership teams at a local level, and we've chosen in the health service to say that the 216 trusts, which are responsible for about 90 billion of the 130 billion and employ 800,000 of the 1.3 million staff in the NHS, they're responsible for overseeing the delivery of secondary care services, so 1 million patients every 36 hours. So the real question is the degree to which we say we're going to trust those NHS trust boards and their leadership teams and the middle management teams within them to get on with doing what they need to do, and the degree to which we're going to micromanage them and tell them you've got to do your job in, this job needs to be done in this particular way. And I think the frustration, in the past has basically been that people have felt that NHS England, NHS Improvement, the Department of Health and Social Care have basically got that balance wrong, and they've been too prescriptive. Examples would be that I think, again, it's very important that our politicians who are responsible for the NHS should be accountable to Parliament, but quite often what we hear is effectively the CQC, NHS England, other bodies effectively asking for the same information and asking for it very, very quickly. Huge amounts of information returns needing to be produced to enable that accountability to be exercised. So those are the kind of things that frustrate people.
And if I may, would you say that there's too much paperwork?
Well, yes, I think people would definitely kind of say that. I think we're changing. I think, as Jeremy will know, we've got a new structure in the NHS where we have, for example, a chief operating officer in NHS England and Improvement is a trust chief executive, a former trust chief executive. We have a regional structure now where 2 of the 7 regional directors are people who come from a trust background. So I think we're trying to cut the amount of paperwork. We're trying to let people kind of get on with it. But in a centralized structure like this, you can absolutely, you can see why those at the centre feel themselves accountable and therefore want to basically, get huge amounts of detail and also specify in lots of detail what the front line should be doing. And we need to get that balance right.
The reason why I ask in part is one of the examples I was given. I recently produced a report with some colleagues looking at community and volunteering in particular. And I spent the day with St John Ambulance, who told me that prior to the start of lockdown last year, they were never able to help on wards, even though they had the capacity and the skills to do that, which once a lockdown happened, some of that red tape at the bottom level, as it were, was able to be released. The agreements were put in place and they were able to help and made a big difference. I also volunteer myself at my local hospital. I've seen the impact of volunteering. Do you think that's something that we should encourage moving forward? I've proposed the scheme of an NHS cadets system, for example. Is that something that you would say would be beneficial?
Well, I certainly believe that there is a real opportunity to harness people's commitment to the NHS and the skills that many volunteers have. And I would say I could point you to some very specific examples. King's Hospital is a very good one. College Hospital is a very good one, where they have, I think it's 1,000 volunteers who work out on a very regular basis. My wife volunteers for the Royal Free Hospital just up the road, and effectively with a bunch of hardy volunteers has done a fantastic job to transform the garden. So there's a really good opportunity to do that. I would be the first to say that this is not something that is universally taken up by all of our members, and I think we could definitely do better here. The whole thing about the relationship between the NHS and the third sector is something that feels to me, I've always felt, is underexploited. So yes, completely agree. Whether we should, quite how formalised it is, quite how much we leave it up to local individual organisations to do that, interesting debate.
Fantastic.
I'm sure the committee would like to put on record our thanks to Charlotte for her volunteering.
Absolutely. Thank you. And to all volunteers, actually, if I may, because I've worked alongside some incredible volunteers. If I may, I just had a question to Dr. Hughes, if I may, just regarding the impact specifically on mental health wards. I can imagine, not just during COVID, but generally they're very high stress environments. And I just wondered from your work whether you found that the level of stress in mental health wards for staff there is something that's actually looked after, because I imagine they must deal with really difficult situations. Are they getting the support, the counselling, the follow-up as staff to enable them to sustain that level of work?
Well, thank you very much. And what we found from our surveys is that when it comes to the cultures in the community and mental health trusts, they tend to be the better cultures across the NHS. And I think that one of the things that's really significant about that is that the leaders in those organisations are familiar with dealing with people in distress, and that knowledge and skills is taken forward to how they support their workforce as well. And I think that clinical supervision also forms a really important part of that. So consistently year on year, we've seen that the cultures in the community mental health trust and those who manage patients with learning disabilities are consistently better than in the other types of provider. And I think there's a great deal of learning that can come from those organisations to share their experience and expertise in terms of how they take their skills and use them to support their workforce. As I agree with you, dealing with very, very difficult and stressful situations, particularly during the pandemic.
Thank you.